Welcome to the Rich and Mo Physiotherapy series. Today we are hosting Shaynaz in our channel. Shaynaz is treating pelvic floor disorder, and we're going to ask her a few questions about this very interesting subject.
So hi, I'm Shaynaz Abwani. Thank you for having me today.
With pleasure.
I've been a physiotherapist for the last 18 years. I have started working with the pelvic floor in 2006, so 12 years ago. Right now I'm pretty much exclusive to pelvic floor. There's so many women who are suffering, and pelvic floor has come about in the last few years, and more doctors and more patients are finding out about it. So it's very interesting part of the body, and I'm excited to talk to you about it today.
And we are very excited to have you here. So pelvic floor is a very mysterious subject, even for us, most of the therapists. Can you tell us a bit about what is it? What is the pelvic floor?
Yeah, absolutely. So we have a miniature model today of the pelvis. And the pelvic floor basically sits right over here. We're actually sitting on our pelvic floor right now.
Okay, I don't sit on a bed, but...
Oh, yeah. Yeah. The pelvic floor is a band of muscles that's found right here at the bottom of the pelvis. So when you're sitting, you're actually sitting on a band of muscles like a hammock, and we call it the pelvic floor. Okay? So you can imagine that it's got to be strong enough to support all our organs and all our cavities, the pelvic cavity, abdominal cavity, pleural cavity, but it's also got to be flexible enough because we move around all day long.
So it has to combine strength and flexibility.
Exactly.
And what happens if it's not combining these two, if someone has a weakness or...
So that's when we run into problems, and that's what we're going to talk a lot about today.
Okay. Great. So one thing that I know, even from my physiotherapy study, which happened somewhere in 2006 or 2005, is the Kegel exercises.
Mm-hmm.
And I even know from personal experience, when my wife gave birth and she had some problems afterwards, they told her do Kegel exercises. Can you tell us if it's enough, this exercise, if it's any good?
Okay, that's a great question, because first of all, a Kegel exercise is already a mystery. Most people, when I say show me a Kegel exercise, are doing it completely wrong. Most people will compensate by pulling in their abdominals or using their buttock muscles, and that actually makes everything much worse.
So it actually can make you worse?
It can make you worse, yeah. So
wow.
Number one, you need to learn how to do a Kegel properly. Somebody needs to show you, and we usually do that internally. We teach you internally what muscles to use and how to use them. There's the strength of the contraction, there's the duration of the contraction, and again, are we using Kegels for incontinence? Are we using Kegels to bring back stability of the pelvic floor? So all of that depends on what we find at the evaluation.
So apparently it's not enough. Now, we always talk about pelvic floor and we always talk about women. Apparently women have more problems, but what about men? Are there any men that suffer from pelvic floor problems?
A lot of men suffer from pelvic floor problems, and a lot of male patients I've treated have gone to several doctors because doctors don't know what to do, where to refer these men. A lot of men end up getting lots of medications, including antidepressants and strong pain medications. So we absolutely do treat male pelvic floor because all males have a pelvic floor, and again, it's a band of muscles supporting all our organs, right? So males, most of the males I treat are either for pain or for incontinence, which is caused by prostatectomy. So when I see somebody post-prostatectomy, they're incontinent, very incontinent, and we usually resolve that in about 3 to 4 sessions maximum.